Hi guys, Dr. Eilbra here. Welcome back to the channel. In this video, we will be talking about the thyroid function, the medications that are used, and what foods, vitamins, and minerals you should incorporate into your diet and lifestyle to maintain a naturally healthy, functioning thyroid gland. Now, the thyroid gland is this beautiful butterfly-shaped organ composed of two symmetrical lobes, one on each side of the windpipe. The thyroid gland synthesizes and releases thyroid hormones, which are solely responsible for our overall health, such as our metabolism, cardiac, respiration, and brain system functions, body temperature, body weight. There's also skin dryness, menstrual cycles in women, and also cholesterol levels. Now, there are two conditions that can arise from a dysfunctional thyroid gland. And the first being is hypothyroidism, and this is an underactive thyroid gland, and the most common cause of hypothyroidism is Hashimoto's disease. The second condition that can arise from a dysfunctional thyroid gland is hyperthyroidism, and this is an overactive thyroid gland, and the most common cause is Graves' disease. Now, your doctor looks at two lab values, and this is usually conducted through a blood work, to determine your thyroid function, and the first level that they look at is T4. The normal range for T4 is 0.7 to 1.9 nanograms per deciliter, and TSH is the second lab value that they look at, and the normal range for TSH is 0.3 to 3 milli-international units per liter. You definitely want to make sure you get your T4 and TSH checked every 6 to 8 weeks until euthyroid, or your levels for your thyroid function, are back to normal. And then 6 months later, and then a yearly follow-up with your doctor is recommended. Now, with hypothyroidism, we see a deficiency of T4 and an elevated TSH. And the most common medication that is prescribed in practice for hypothyroidism is levothyroxine, which is the generic form for Tirosint or Synthroid. So based off of your thyroid function, your doctor prescribes levothyroxine, and levothyroxine comes in a range of 25 micrograms all the way up to 300 micrograms. Levothyroxine is a daily dose tablet. It's preferably best to take it on an empty stomach first thing in the morning, half an hour before breakfast, and you want to make sure you separate levothyroxine about 1 to 4 hours apart from any other vitamins that you may be taking, such as vitamins A, vitamin D, vitamin E, and vitamin K. Any weight loss medications such as Orlistat or Ally, any iron supplements should also be taken 1 to 4 hours apart from your thyroid medication. Now, the most common side effects of levothyroxine include increased heart rate, rash, weight loss, irritability, and if you experience any of these side effects, you definitely want to follow up with your prescriber. Other medications that are prescribed for hypothyroidism include liothyronine and Cytomel. Now, levothyroxine is pregnancy category A safe, and it's also safe during breastfeeding. And if you have any questions in regards to levothyroxine or any of the side effects, please consult your prescriber. Now, in the case of hyperthyroidism, the most common medications that we see in practice are methimazole, and the normal dosage for methimazole are 50 to 20 milligrams every 8 hours until euthyroid is achieved, and then the patient is switched to 5 to 10 milligrams every day. The second medication that is seen in practice is PTU, or propylthiouracil, and the normal dosage for PTU is 50 to 150 milligrams every 8 hours until euthyroid has been achieved. Now, PTU is preferred during the first trimester, and then the patient is switched to methimazole after the first trimester. Most common side effects of both of these include rash, GI upset, and if you experience any of these symptoms, definitely want to consult with your prescriber. Now, the best foods to incorporate into your diet and lifestyle would be foods that are rich in vegetables and fruits. So highly recommend kale, dandelion, spinach, all sorts of berries into your diet and lifestyle. Also iodine containing products such as fish, cod, and tuna. Definitely want to incorporate vitamins such as vitamin B12, also found in beets, in spinach, selenium, which is highly abundant in Brazil nuts, also zinc, which is highly abundant in pumpkin seeds. Also try to incorporate ginger and turmeric. For more information on ginger and turmeric, I'll go ahead and link the videos down under the comment section below. So with all that being said, I really hope you enjoyed this video. Hit that likes button. Go ahead and leave a comment down in the comment section below. Thank you, and we'll see you in the next video.